Hi there, I'm Dr. Tim Fargo. I'm the Clinic Director at Chiropractic Health and Wellness Center in Edina. I'm also the founder of ScoliTech. It's a company that does natural alternatives to scoliosis treatment for patients of all ages. I wanted to spend a few minutes with you today talking about scoliosis, a subject near and dear to my heart. I will tell you that this is a condition that concerns many people, not just children, but also adults. To define for you, a scoliosis is a spinal deformity, which means that it does involve actual change in the shape of the spinal bones. I'm going to show you. A scoliosis is actually a sideways curve of the spine. By that I mean this way, that involves rotation, either of the vertebrae themselves or of the rib cage. If you've seen a person with scoliosis, you may have noticed that they may have a rib cage that's humped, if you will, or pushed out on one side. The most common type of scoliosis is known as idiopathic scoliosis. Idiopathic scoliosis, it's a $10 word, but basically what it means is that the scoliosis is of no known cause. If there's a known cause for it, it's not idiopathic. Idiopathic scoliosis can affect infants, and I've seen cases of it, juveniles, adolescents, and even adults. It's defined by when the scoliosis is actually identified, and it's determined that it's of no known cause. Idiopathic scoliosis is the one that really gets the most press because as adolescents or children develop curvatures, those curvatures can progress or worsen to the point that they require surgery, bracing, or other types of treatment. This is of great concern for parents because if you've ever seen scoliosis fusion surgery, it is pretty severe and you never want to have your kid have to go through that. Generally speaking, idiopathic scoliosis, especially in children, is not pain-producing. If I haven't already said it, about 80% of all scoliosis cases are of the idiopathic category. A second category that's also very common, about 10% of all cases, is adult degenerative scoliosis, which occurs when a person's spine starts to degenerate through arthritis, disc degeneration, and then starts to form a curvature which over time progresses. There is a common idea, particularly in conventional approaches to scoliosis, that once a person's skeleton has matured, there's no risk of progression, there's really nothing that should be done, and a watch and wait approach is taken. Nothing could be further from the truth. The basic fact is that the distribution or the statistical distribution of scoliosis in the population is about 2 to 4% of the population at the age 18. By the time a person reaches 60 years old, the percentage is about 30% of the population. What does this tell us? Scoliosis is a progressive condition. An article in the 2017 edition of the Archives of Physical Medicine and Rehabilitation indicated that the mean rate of progression is 1.47 degrees per year, which, what does that mean? If you're an adult, and this is in adults, if you have a 20-degree curve, within 10 years you might have a 35-degree curve, which is really, really serious. So, the point is, scoliosis is progressive. It's something to really pay attention to. In the next videos, we're going to talk about how to detect scoliosis in yourself, in someone that you care for, in a friend. We're going to also talk about natural treatments, including when should one do various things, ranging from physical therapy, to chiropractic care, to bracing, to surgery. There are thresholds for all of these things. Thank you very much. I appreciate your time.